Hello and welcome everyone to another this is a special presentation through the NECOM Johns Hopkins ERC collaboration for continued education courses. Um, Unfortunately, this is not going to be a CME qualified course, but this is a very, very novel and interesting approach to treatment with sustained acoustic medicine. My name is Chris Spicer. I direct continued education and outreach for the Region 3 ERC housed at Johns Hopkins University. Uh, Keith Choi is our senior program coordinator. And we love collaborating with NECOM to produce these for you all. Today, we're going to be listening to ZetrOZ systems on sustained acoustic medicine. And I would like to introduce to you Bob Ashley, the Director of Sales for ZetrOZ. Go ahead, Bob.
Awesome. Thank you, Keith and Eric, for setting this up. And just wanted to thank everybody for taking some time out of their day on Friday to learn a little bit about SAM and what it can do for soft tissue injuries. I'm the director of sales for ZetrOZ, so I work with a lot of our distributor partners who are really wholesale partners. They'll generate prescriptions, work with physicians throughout the country to make sure that we're able to get the technology to patients that have soft tissue injuries to help speed up the repair and remodeling process and ultimately create better outcomes. So to make sure that this is helpful and educational, I'm going to stop talking and turn things over to Dr. Mallipudi. And just a quick introduction for Dr. Mallipudi. He is our Director of Medical Education, and we really appreciate the partnership we have with NECOM as well, and glad that we get an opportunity to do this with a really great group of people. But Dr. Mallipudi is our Director of Medical Education. He's been partnered with ZetrOZ for several years and just helping expand education within our organization and out to other organizations like this group. He's not just the director of medical education, but he's also a big SAM user. I'll let him get into some of the specifics, but Dr. Mallipudi plays hockey, he power lifts competitively and enters bodybuilding competitions competitively. So he stays very, very active and continues to use SAM as a recovery tool and just to help with some of the injuries that he's dealt with. So happy to turn things over to him and hope that you all, let's keep this pretty interactive because this is non-CME. I think we can have a little more open discussion. So if anybody has questions, please throw them in the chat. We'll keep an eye on that. And without further ado, Dr. Mallipudi.
Great. Thanks, Bob. Thank you, everyone, for coming to join us, Chris and Keith and NECOM for helping organize this. So really excited to get into this. I know everyone's time is valuable, so let's get right in. Focus of this conversation is going to be on the SAM, sustained acoustic medicine. What I want you all to walk away with is understanding what happens with soft tissue injuries, how the SAM helps repair that soft tissue injury, and also getting an idea of how this is going to help your patients when it comes down to treating them and get an idea of how this elevates their guide, different ways you can implement it in guidelines for treatment. Okay, so let's hop right in. First thing we need to understand when we talk about the SAM is what is going on with an injury. So very commonly when you're working with athletes or patients who may have workplace injuries, it's going to be that acute injury. There's certain phases that occur, and it's inflammation, repair, remodeling. The reason this is so important to understand is it allows you to understand how that injury happens and how the SAM being used at appropriate times can help patients recover quicker. So when someone gets hurt initially, there's going to be that inflammation that occurs. We're all really familiar with that. It's vasodilation, increased blood flow to the area of injury, cytokines. There's going to be that warmth to the area of injury. But also the body, as its way to protect itself, saying, hey, I'm hurt, and it's able to protect you in a way, but not worsening that area. You're not using it as much. It's swollen, it's painful. You're trying to protect it. In addition, after this phase subsides, then you go into the repair. This is when the body is going to try to repair that process, whether it's a tendon, a ligament, a muscle. What's going to happen is now the inflammation's gone down, fibroblasts are now going to be laying down, also new collagen's being repaired, and that tissue is trying to mature to get stronger. The concern during this time is that patients sometimes think, oh, I'm feeling good. They get back and they can injure themselves. But when we finally get to something called remodeling, that tissue with the collagen that's laid down is now hopefully strong enough to withstand the forces that are required for whether it's patients playing basketball, they're jumping, they're sprinting, they're squatting like 500 pounds, they're playing hockey, basketball, whatever it may be, they're able to withstand those forces and get back to what they're doing with those activities without injuring themselves. So what's going to happen now with the SAM is now that we see these stages, we want to see how could the SAM shorten those phases? How could it be used with shortening inflammation, repair, remodeling? And in turn, by having that phases be shorter and having the body go through that recovery process faster, patients again are able to do the things they like to do. Now, what is going on? What's unique about the SAM? What's unique about it is what's the technology behind it. So it's using something called ultrasound. Now, ultrasound's been around for a few decades. It's been used in different type of therapies with ultrasound in the outpatient setting. That's used by orthopedic surgeons, sports medicine doctors, athletic trainers, therapists. Basically, what's happening is that the ultrasound is using four key ingredients involved to repair. There's going to be compressive forces, which is when the ultrasound is able to actually go through and by compressing and then expanding the tissue and stimulating it. In turn, there's shear force, which is almost like a friction on the cells as well, which activate the repair process. There's also microbubbling and cavitation, where there's heat that's released, and there's that bulk flow, that increased flow of nutrients and blood to the area where you're injured, and that allows for more transport phenomena. So by having compressive forces, shearing forces, microbubbling and cavitation, and that bulk flow to that area of injury, those four things work in conjunction as a biomechanical stimulus that accelerate and activate the normal physiological process to repair. Again, the body is going to try to repair those injuries, but by enhancing it through these forces, it's going to be done faster. So those stimuluses are very important to be implemented. And by doing that, the body can go through those phases of inflammation, repair, remodeling, shortening the time frame between each stage. Now, when you look at a picture, what we see here in picture A, you're going to see that when someone has the SAM applied on it, such as over here with where the ultrasound is applied on, that's going to have increased cellular proliferation. The tissue regenerates. There's more vascularity. You get more blood flow, and when you're using it 4 hours at a time. And at a deeper level, this also increases the capillary permeability. Now you have greater oxygen exchange, nutrient exchange at that area of injury. And lastly, you also have the vasodilation, which now the vessels themselves are wired to have that increased blood flow. I'm going to show you guys a video. I'm going to walk you through what is happening in each one of these phases. So here what we're seeing is someone is going to have an elbow injury. Oh, it's on mute. Sorry about that. So someone has here a right maybe tendonitis at this time, perhaps a tennis elbow, getting hurt, then they're feeling a lot of pain and swelling. That's the inflammation phase at that initial part. Now the muscles aren't as strong, there might be some tears in there, they got a lot of pain. When patients are now applying the SAM onto the area of injury, what's going to happen is that these patches have on the right there the gel that's attached, which is going to be put onto the elbow. And now when the ultrasound's applied, it's going to stimulate over 4 hours at a time and allow those forces that we talked about, the compressive forces, the shearing forces, the microbubbling and cavitation, and that bulk flow to the area of injury. All four of those biomechanical forces are now allowing you to have deeper penetration as much as 5 centimeters into the tissue and getting increased heat, circulation, and also that pressure from those biomechanical stimuluses that we went through. Now, that is all happening to allow more nutrients, oxygen, and stimulation of the collagen matrix rebuilding process. So now those fibers are able to get stronger. You also activate proliferation, TGF-beta, which is upregulated as well. And in turn, now you can go through those phases quicker. What's also important to understand during this time is patients feel a lot of relief as well too, because they get that heat, which is a byproduct. This is not just simply heat of putting on like a heating pad onto your elbow. Rather, they get the heat that comes through the ultrasound, but deep down, they're treating the underlying cause. And that's the key takeaway. While you may feel pain relief with any type of heat, what's different with this is not just going into a sauna or putting on a heating pad. I'm actually using ultrasound with those biomechanical stimulus to enhance and repair the soft tissue injury itself, and patients get the pain relief. So it's an FDA cleared device that we use. It's 4 hours at a time. It's about over 30 different research trials. It's wearable, it's easy to use. And when you compare it to what's been used in different type of ultrasound treatment, you see pretty significant differences. So it can be applied for 1 to 4 hours at a time. And when it's used for 4 hours, it applies 18,720 joules. Standard ultrasound, if you use it in a clinic, can be anywhere from 2 to 5,000 joules. And this is also different from an exogen device, which is a more of a bone healing ultrasound using pulse ultrasound. That one uses a lower amount of joules, and it's also not FDA cleared at the time for any type of soft tissue injury. The SAM is, and that's where most of these injuries are happening for patients or workplace injuries or for athletes. In turn, when we use the SAM, because of how easy it is to use by simply putting on the product and having the patients apply it, they don't need to have the complexities of using using an in-office type of ultrasound device, which requires patients or really the healthcare professionals. They have to adjust the frequency, the intensity, the amount of time that it's being used. It's very user dependent. So when someone is able to put on the SAM device, it's at a set intensity, set frequency, set amount of energy. All they have to fix is turning on the device, having it fully charged, deciding if they're going to get treatment for 1 hour or 4 hours. Because there's two transducers, it is allowing the SAM to be used for a longer period of time to get deep penetration to as much as 5 centimeters, which is about 2 inches. In turn, they can use it for various parts of their body. They may find that, hey, today I'm a little bit hurt in my new injury of my shoulder, perhaps as a rotator cuff injury from maybe they were pitching a baseball. Then they find perhaps after a long run, they got an injury on their knees. They want to be able to apply it on there. There's different places it can be applied based off of where the injury is. You can even use it multiple times a day. That's very different from what you see as a clinical ultrasound device, which requires you to get in the car, drive over to actually get treatment. So there's some big differences in that. In turn, because it's usable and portable, patients can even use the device while they sleep, while they're doing work from home, while they're in church or going grocery shopping, or even going for a walk. It's something that can be worn underneath the clothes, and it's easy to use. It's not very obvious at all. There might be a little lights there at times, depending on if you're wearing different light clothing, but it's something that allows patients to go on with their day as an adjunct to perhaps that they're already getting physical therapy. So sometimes when people see this device, they gotta go, well, what's the difference with the TENS? So TENS device, right here. TENS device, when we're typically thinking of that, transcutaneous electrical nerve stimulation, that's more of a pain modulator. Really want to emphasize that. It's a pain modulator. You put it on, patients hopefully are not feeling some pain, but it's not treating the underlying cause. With the SAM, because it's being used to treat the underlying cause, patients then also feel pain relief. Those are two different things. One is kind of masking the pain, giving them pain relief, but not treating the underlying soft tissue injury. The other one is directed towards the soft injury, and that's the SAM. It's a key difference. And that's why when we want to look at what's working to get patients to repair faster, you really want to look at what's treating the underlying cause. In turn, we want to also look at something else of the treatment dosing. So the SAM itself can be used for 4 hours, as we talked about, 18,720 joules. There's different types of treatment can be used for a wide variety of injuries, osteoarthritis to even really severe calcified tendonitis, which may require as much as 8,000 joules. But because it's so much more joules applied, it could be able to cover a wide spectrum of injuries. In turn, we have to also look at that treatment dose. One question that comes up is, well, how can you do ultrasound for 4 hours? Are you going to hurt someone? While that's typically true for clinical ultrasound in the office, which uses a high intensity, the SAM device uses a lower intensity, which means that there's less to the area of the treatment, which allows patients to have a more longer therapeutic dose without causing trauma. In addition, the SAM device also has a patented regulator that can actually detect where the heat's at. So you want to think of a thermostat at home. Maybe you set it at 70 degrees. So if it drops below 68, it turns on and wants to keep it around 70. Okay, so this way, if it's in the winter, I'm not getting too cold. But also, it also notices, hey, we're getting too high, so I want to keep that steady state. So it's going to keep it at 70 degrees. But the SAM, because it's got that detection, it's able to light on when it goes, okay, we're heating up. We don't need to be that high. And it's able to keep the heat controlled. So this way the patients get that treatment dose with the ultrasound without causing any trauma to the area of injury. And that's a really unique aspect to it, which again allows patients to get a longer treatment dose over that time of 18,720 joules. The device itself, pretty straightforward. You're going to have two different types of transducers, as you would see here. Oh, sorry about that. So sorry. Uh, Put on my laser pointer. You're gonna have the SAM applied with two different trans applicators that are going to be applied to the patch itself. In turn, they're going to light up with this will be a blue or red. Blue is when it's on, red is when it's off. Also on here, all the patient has to do is charge it up below, and then when they turn it on, they hold the big blue button down, and then click the right side blue button to indicate if it's going to be 1 hour, 2 hours, 3 hours, or 4 hours. They apply the patches on. That's it. We also have another device that's being used as well. That's going to be with the X1 showing here. This is Bluetooth technology. This one is only used for 1 hour. Some patients may like it from a more regenerative medicine, in which they don't have many severe injuries, but allow themselves to recover. Perhaps this is mostly for patients maybe in sports who go after the gym, say, hey, feel a little sore, not too hurt. I don't need anything for too long, but I just want to feel a little fresh for the next workout. They may apply it on for an hour or so to help with the recovery process itself. Again, it's going to be 1 hour versus the SAM Pro 2.0 is going to be 4 hours. So that's one of the key difference along with this being Bluetooth. So the SAM device is used in multiple teams, professional, collegiate sports, particularly at D1. We see it used with chronic injuries for baby boomers, of course, for U.S. veterans, the military, and Medicare for arthritis. Now, the key aspect I really want to go into, which is the bulk of this, I want you to take away some of the clinical studies. Obviously, I'm not going to go through every clinical study here. I do want to highlight some pertinent ones because I think when you hear about this research, it'll give you some takeaways from it, which you can think of how could this apply to some of the patients that you may be familiar with or you may experience, and how this can make them have a better quality of life. So the first one I want to go into is a meta-analysis that was done in 2021. This was looking at the use of the SAM with 372 different subjects, looking at different injuries, knees, cartilage, shoulders, neck, soft tissue injuries, trying to understand what's the big what's the big takeaway? How do these patients feel after they use the SAM? And what kind of conclusion can we make about the SAM itself? What they found is that when they were able to do this one with these patients, they were able to narrow it down. And they found that when looking at shoulder and neck injuries, those patients seem to have favoring the use of the SAM for their clinical outcomes, and in which case there was reduction in pain and overall healthcare improvement scores. That's key because that's how the patients themselves perceiving the treatment and how they're able to go on with their quality of life. If someone's being hindered to the point where maybe they can't use the bathroom, they can't drive, they're not able to raise their arm up, they're not able to do some of the even clean themselves out the bathroom. Those are activities of daily living that are severely affecting them. But if you're having a better outcome, you're feeling less pain, you're getting more functional mobility, you're having greater strength come back, that's able to show that you're having that improvement as well. And they were able to show that for these patients with the use of the SAM overall. When they also looked at the use of heat in some types of joints, such as the knee joint, looking particularly at osteoarthritis, again, they were able to show that patients using the SAM were having some improvements as well. They were also able to show that when scientists compared the use of the SAM compared to those without it, that it was definitely a lot warmer, which makes sense. And in turn, when those patients are using those devices, again, the key thing is how are they perceiving it? Their WOMAC scores may have improved. In addition, again, they're feeling a greater strength, less less use of narcotics as well, because their pain is getting relieved. But again, it's getting relieved because of the ability to treat the underlying injuries. That's the big takeaway. When we also looked at this as well, we were looking at different studies, trying to look at specific ones, looking at elbows and tendinopathies, which I'll go into too. This one was unique because it showed that those patients were able to have different types of outcomes, particularly at 2 weeks. Now, the reason 2 weeks is so important is when patients are treated, yes, they'll be treated in this study for about 6 weeks. They're going to have improvement, as you see by the slide, but 2 weeks seems to hit that golden number. You're going to see that a lot. The reason this is key is when went back to that first slide I showed you. That first slide showed three things. When someone gets hurt in soft tissue injuries, there's going to be a phase. It's inflammation, repair, remodeling. The SAM, the earlier it's used, is able to shorten those time frames of inflammation, repair, remodeling, allowing them to improve. So if I'm able to get someone those first 2 weeks feeling, wow, I'm feeling a lot better. I'm getting fantastic results. I'm stronger. I'm able to move. I don't have pain. That's because, again, they shorten that phase of inflammation and they're going through that repair process much quicker. It's enhancing, remember, the physiological process. So these patients in their elbow tendinopathy, they were able to have improvement scores and reduction of their pain by as much as 4 points in 6 weeks. They also have improvement of the grip strength that was observed in 2 weeks. And again, you're seeing also here in this graph, 2 weeks seems to be the golden number when you see those significant improvements as well. They also did another study looking at the use of the SAM on soft tissue injuries as an add-on study. So what this means is patients are going through doing their particular, PT at home. They may use the SAM as add-on, okay? And they're trying to see if it reduces the pain and allowing the patients to get back. When it's found, what it was, traditional treatment is going to be rest, the ice, compression, elevation, all those things. Perhaps they were even doing some physical therapy for a while. And of those athletes that were being tested, whether it was from their injuries for their arms, their shoulders, their glutes, their legs, when they were using the SAM, 93% reported the therapy was able to help at the time. 87% of them reported improvement, and 50% were able to return to work by as much as 2 to 4 weeks. Again, huge improvement because we're seeing them shorten those phases of inflammation, repair, remodeling. That is the key takeaway. And over 50% of those athletes were able to return to their sport, again, a lot sooner than if they just did with the use of the SAM in addition to their current studies. Big difference. They also did another case series, which we're waiting to be published as well, hopefully later on this year, looking in Colorado at patients who were treated with the SAM and seeing again what happened if they had this also used as well to help them and as an add-on study. These results were interesting too. So MMI is maximum medical improvement. That's you looking at again patients going through physical therapy, saying, okay, this patient's with the elbows, they did 19 physical therapy sessions. They may not feel like, hey, I'm not really getting any better. After 19 physical therapy sessions, they had the SAM added on, and their scores improved from 3 out of 12 to 8. And that's huge. Okay. Now they have greater strength, greater functionality, less pain. When they look at their shoulder, some of these patients went through 24 physical therapy sessions, not feeling any more improvement, had the SAM added on. So now you have the SAM plus the standard medical care with physical PP. Their scores improved from 4 to 10. Again, over 100% point improvement, about 150%. And those patients, again, are reporting improvement, but despite not getting better before. So when we go back to that first picture we showed of inflammation, repair, remodeling, remember how that repair and remodeling could be as much as 6 to 8 weeks long? Well, this makes sense because now with the SAM added on, I'm able to shorten those phases where patients may not have been feeling too much better before, and now I can accelerate it. So now I'm getting to complete the remodeling stage. This is so key of how the SAM can be used. Yes, earlier is better, but even for patients who may have been having slower progress after a period of time are getting relief and improvements as well too. Then they also looked at patients with low back injuries. In this case, it's a little different. A lower score indicates higher function. These patients went through 34 physical therapy sessions, had the SAM then placed on, and they were also noted to show improvement of their scores too. So again, big improvement as you're seeing these patients being able to get back to work sooner and just feeling a lot better quicker. If you look at a big scope view as well too, patients that go through, the standard RICE therapy, NSAIDs, physical therapy, they could be out of work for quite some time. And sometimes if they're out even a little bit more, they may need to go for surgery, further imaging. They may have done cortisone shots. They could be out of work about 26 weeks. With the use of the SAM, it could actually help reduce that cost by having patients go back to work sooner, being able to save as much as $27,000 per patient. But again, it's because you're seeing in these studies, patients are getting to work sooner. They're getting that pain relief sooner. Again, they're going through that inflammation repair remodeling faster. You're seeing progress quicker within really those first initial 2 weeks. And the hope is that by using this on a broader scale with multiple patients earlier on, you get them to work sooner. You don't need to be worrying them about, workplace compensation or the amount of work, getting all this coverage as well. You're getting them back in there as soon as possible. That would be a key aspect for them. One other aspect that we were looking at too is how can we make patients who are having these pains feel pain relief quicker too? So something that a lot of patients are using sometimes for, especially for arthritis, is Voltaren, which is diclofenac. It's an NSAID that could be applied topically. What we found is that when diclofenac is applied with the use of ultrasound, using what's called sonophoresis. Sonophoresis is the use of ultrasound for drug delivery. When the SAM is using patches containing diclofenac, it's able to deliver it 3.8 times faster versus someone just taking diclofenac on their hand and rubbing it on their skin. Now, this allows those patients to get pain relief much quicker, obviously. But in turn, one thing that was the most fascinating from the study is that you're seeing that there's a 70% pain reduction in those who get it for their first treatment. And those are people that are called first responders. Rapid responders are classified as those patients exhibiting greater than 1 point reduction in pain following the first treatment. Okay. That is very exciting because if you look at patients, especially with chronic pain, you see this opioid crisis, you're able to find the use of a SAM and diclofenac to help patients get pain relief. And 70% of the time they feel pain relief in that first treatment. That's been fascinating. That's exciting. This is an alternative way in which we can now have patients get treated for the underlying injury and do it in a way that is not related to an opioid addiction without getting them dependent on anything with that. So very exciting to see as well. And over 94% of those patients, they did complete the study and were able to show significant improvement. Up to 50 to 70% had pain reduction that first week. The knee functions improved by 351 to 510 points. Overall improvement of quality of daily living. These patients were really, mostly that were tested were those with cartilage degeneration over time. And over 6 weeks, you could see from the chart very clearly, those with SAM and the use of diclofenac very clearly are having massive improvements. And again, for those rapid responders, they had the most significant improvement within those first 2 weeks, which is very exciting overall. So what you want to look at is, again, in those first 2 weeks, how can I get something that gets patients to be compliant with them and get them pain relief in a way that's not related to opioids, and also they're getting those improvement in their functional score. And this is something that we're seeing overall. They also did another study that expanded on this too. Let me just pull this up here. Sorry about that. Right there. You could also see from this picture as well too. This study was done looking at with Jarrett. Was looking at the use of now increasing diclofenac from 1% down to 2.5%, and this was used over 4 weeks. And there were pain reduction scores by as much as 4.4 points, health improvement scores by as much as 4.85 points, and almost 98% of functional improvement in those who were getting treated with the SAM and diclofenac. That's huge. So a lot of people are feeling that excitement that, hey, I'm getting pain relief. And again, most of that is going to be related to all those different types of injuries we've been talking about, tendinopathies, sprains, bone fractures, any type of cartilage issue, arthritis. You could see those scores showing those improvement with their numerical rating scale scores being lower because they're feeling that improvement compared to before. It's not as severe. Patients, again, getting that pain relief. You're enhancing their ability to get back to doing what they want to do, not being in pain, and doing it in a safe, non-addictive way. Outside of that, there's also research done by athletic trainers of how they perceive the product as well. They were sent out a huge survey, and we looked at it, and this looks like about for the SAM, about 83.9% of the injuries that were looked on, they were really focused on healing tendons and ligaments for about 87%. The SAM showed again in 2 weeks, this case, the trainers felt that about almost 70% of the time seemed to really help in those first 2 weeks, and about 50% reduction in pain was shown too. Patients were highly receptive to the treatment, and athletic trainers felt very confident in it, about 81% of the time. So you have not only the patients feeling confident in the product, 87% of the time, but athletic trainers too. And in turn, you're seeing that number again, 2 weeks, 2 weeks, 2 weeks. Again, you're finding ways to enhance, super accelerate the body's repair process. And those 2 weeks is huge. Another study that came out towards the end of 2024, really exciting, was looking at chronic pain of the back. So patients were screened. They were looked at with those with MRI disc herniations, which is huge ongoing issue for patients, especially older patients, and a very common workplace injury as well, even for younger people. And they applied for 65%, took 65 patients. They had them taken. They looked at placebos and the active group, broke them up, and they applied the SAM, as you can see in the picture on the lower back, those two patches right there. And what they found was around, in this case, the 4 week mark, they had the greatest pain reduction by as much as 2.58 points. And it seemed to reduce over the course of 8 weeks. These patients, even with debilitating back pain, were able to report increased physical activity. Their quality of life scores were improved. And one thing I think is very significant is that there's a 22.5% reduction in the use of opioid medications. Chronic back pain is a huge problem and a big starter, unfortunately, for a lot of patients who get onto Oxycontin, oxycodone, Dilaudid, morphine, and it's a slippery slope, as we all know, in the healthcare field. Finding a way to reduce, and even in this study, 22.5% reduction in opioid is huge. And on top of that, at the end of the study, all these patients who were using the SAM, they felt significant pain relief, but 100% said they felt pain relief, they had increased quality of life, and they all wanted to continue using the SAM after the study, all of them. And this go with that theme that we're seeing, which is patients are getting pain relief, better quality of life, but it's easy to use. It's something that they want to continue. And it's a safer way of reducing the use of opioids. We've even seen SAM used in addition with PRP. Some surgeons love, and sports medicine doctors love using the PRP for some of their athletes. And because of the technology of the SAM using sonophoresis, which is the use of ultrasound for enhancing drug delivery, when patients in this study were given given the PRP, the SAM was applied as well, and it helped enhance the healing process so much more with this drug delivery, which it was helping with, that patients were able to return to play 21 days faster. 3 weeks faster. They also had improvement of 0.8 greater decrease in pain, and their quality of life scores as well was over 1.28 points higher. And after 6 months, this is also exciting, there was no repeat injury during the season or off season. And that's huge because remember we talked about in that first slide, we got inflammation, repair, remodeling. Remodeling is when the tissue is now strong enough to withstand all those forces without injuring itself and able to do all those things like throwing a football or a baseball at like 100 miles per hour, taking that hockey shot, or maybe even running up a slope, or being able to have the knee strong enough that now you can squat 800 pounds without having it, get blown. So all those things are key, but it's about understanding, okay, what am I doing to make sure that I'm not injuring myself? And SAM is a big part of that. The new directions that we're looking at for our studies, looking at bone, also looking at knee osteoarthritis, other soft tissue studies, and also looking at other ways we could have SAM help with heating and sonophoresis. Our treatment doses, I think this is something really important to kind of take away for your patients, is understanding, well, if the only parameter I could change is time, 1, 2, 3, 4 hours, and all the studies are 4 hours. In general, we recommend 4 hours. But you also have to be realistic of how soon are some patients going to get results. If it's an acute injury, again, from all the research we've shown you, about 2 weeks is that golden number. If you use it consistently, 4 hours a day for 2 weeks, you get a lot of pain relief. You're going to help the tendons, the ligaments, the muscles, everything gets stronger. But it's because they're more vascularized. More vascularized tissue has more blood flow to the area of injury because it's more vascularized. But an area like more connective tissue, perhaps it's the tendons or the ligaments, smaller areas to hit, in which case, because there's less blood flow, I'm not going to have as much as you saw in that video, blood flow to the area of injury. In turn, I have to understand it's going to take a longer time to recover, maybe 2 to 4 weeks. And in turn, if it's bone on bone, like an arthritis, there's also limited ability to have blood flow to those areas. So they may take as much as 6 to 8 weeks. So big difference between that. In addition, sometimes we see this post-op, in which post-op we may use it for probably 2 to 4 weeks. Sorry, that's my dog. Sorry about that. So the next thing too is looking at placement. How do we place SAM? There's different areas that could be applied. We see it here on the shoulder. That's where it's applied there. Typically, you want to have this is the X1. You want to have the two patches about maybe 1 or 2 inches apart. This allows a deeper area of penetration, so about the size of a grapefruit, which allows you to get deeper in, wider area to allow for all that heat. You could also see it applied here in the hamstring. So recently I had a hamstring injury about 2 weeks ago, and I felt a lot better using the SAM. I had to apply it in different areas. So sometimes it's more near my inside the medial aspect of my hamstring. So you could reposition it based off of where you feel some of the discomfort is. We do recommend, just be mindful that because there's a patch, some areas, especially like the legs, may have more hair. So just be mindful when you put the patch on or take it off. It could sometimes be a little uncomfortable depending how much hair is there. This is a female model. And this one, you also can see that can be applied to different areas of the feet too. And again, you want to have it generally about 2 inches apart. So this way you're again to be able to get that larger area. So in summary, when we look at this, we had talked about all those stages of the healing: inflammation, repair, remodeling. Inflammation, again, you're going to get a lot of that blood flow to the area of injury. The SAM's hope is that when it's applied earlier on, it allows you to go to the repair process sooner, upregulating TGF-beta, laying down more collagen, having more blood flow. It's doing these things to the biomechanical stimulus, to all those things, 4 areas we talked about: increase compressive forces on the cells. There's also the shearing forces, the microbubbling and cavitation with the heat, and the bulk flow of oxygen, the blood flow, and the nutrients to the area of injury. You have more molecular transport phenomena through the cells. All those things are happening. In turn, there's heat release too. And that's going to also make patients feel better as well. And by enhancing and supercharging those soft tissue repair, now you're allowed to go to remodeling sooner. That allows the tissue now to get strong enough to withstand those forces without having them be injured too soon. So altogether with these things, patients now are able to return to work sooner. They're able to get back to the sports they enjoy sooner. And again, have that better quality of life that they always seek. And I appreciate everyone's time, and we'll open up to questions for a bit for me and Bob. Thank
Yeah.
you.
Awesome. Thank you, Dr. Mallipudi. We've got several questions here in the chat. I'm going to answer a couple of them that I know I can
Sure.
handle, and they're kind of more my wheelhouse. So Dr. Zaya asked about coverage. So workers' comp has been one of our major payers, but outside of that, we do get coverage within the VA. We've had success with TRICARE as well. And then we're right now in the very early stages of a Medicare pilot program. So depending on where you live geographically, we may be able to get authorization for Medicare patients. We're working towards the traditional commercial payers, but right now, that's kind of where we're currently working from a payer market standpoint. Dr. Zaya also asks about the patch being hypoallergenic. So it is a 3M non-woven medical grade bandage. Dr. Malipudi, you may know, I don't think it's specifically hypoallergenic, but it is I would say, pretty universally used 3M product. You may have more info on that.
No, I think we still offer the hypoallergenic one. You can check with George on that. I think it's still there. But in general, we rarely hear patients having some irritation. Sometimes they do. My wife has more like fair skin, so
Hmm.
sometimes if she's like has it on too much, it's a little red, but it just goes away. I think it's mostly because of like how we end up pulling the patch off.
Yeah,
But in general, we haven't seen any allergic reaction to it.
yeah. And to kind of follow up on that, for as far as patch application and getting creative, there are several things we could do for patients that are a little more sensitive to that on a case by case basis. Another question: other countries other than the U.S. where SAM's available? Currently, it is only available in the U.S. That's something that we probably will expand, but it may be a couple years away while we work on the U.S. market here and expanding coverage to commercial payers. Um, Looking forward to bringing it to the Philippines. That would be awesome. And so now some more clinical questions, Dr. Malipudi. I'm going to pass these on to you. I'm going to combine a couple of them. So Dr. Zaya asked early on how it would compare to PEMF or red laser therapy. And then somebody else, Bill Bircha, had a question about it comparing to mechanisms of a hyperbaric oxygen therapy. So if you could just touch on how SAM compares to PEMF, red laser therapy, or even hyperbaric oxygen therapy, um,
Mhm.
I think that you'd be more suited to answer that one than I would for sure.
Okay, well, Sam, again, it's mostly going to be geared towards one of the soft tissue injuries, the tendons, ligaments, and muscles. PEMF typically is used for more of the bone healing, from what I've previously seen. And red laser is usually most of the superficial injuries, although it can help with muscle repair. We see more of the PEMF that's supposed to be used for more of the deeper tissue. But the SAM, because again, it could be used for over 4 hours, it could also get as deep as well too. Red laser typically is around 1 to 5 centimeters, from what we've seen as well too. The one of the key also differences is also like what you're looking for. Again, for more deep tissue repair, that's where the SAM kind of really shines its light. And the other issue with PEMP is that it may be more effective at time if there's more neuromodulation. But again, I think the key thing is what kind of injuries we're looking at. In this case, it's really focused on soft tissue, which is where you'll see the SAM mostly be used. As for what was the other question here? The hyperbaric, well, let me scroll down. Hyperbaric chamber. Uh, where is it? Let me see. Yeah, yeah. For hyperbaric, so that I cannot fully answer on the hyperbaric oxygenation therapy for healing. I know that's typically used for mostly wound healing. Was so a little different for what we're seeing with the SAM for more soft tissue injuries. I can't necessarily elaborate more on that. I just don't have enough information on that because those are a little different. Well, I'm more familiar with hyperbaric oxygen therapy for some of the wound healing. Other questions looking at heat and capillary permeability. Is there a risk of tissue swelling? So we haven't seen that. Initially in the early stages, what we typically see mostly from athletic trainers who tell us this as well too for their athletes. So patients have in college football, they have play on Saturdays, they get a big injury. They may do ice initially for the first 24, 40 hours. They go to the SAM, mostly because the patients early on are just having such severe pain. Help reduce that, and then they use the SAM, helping that blood flow. So I initially try to get some of that inflammation down to those really bad acute stages. For patients who may be after the gym, again, this is for me, this is more of an antidote. If I'm feeling just a little sore, I usually do a cold shower for other, neurological benefits too. Then I'll be able to go with the SAM when I'm going to sleep, but I'm not feeling any significant swelling, so nothing to worry about of making it worse. But again, if it's like a really bad acute injury, we see patients go with the ice first and then the SAM about maybe 24, 48 hours later. For patients with fibromyalgia, chronic pain. So very tricky, as you know, with fibromyalgia. There's multiple issues involved on a not only physical but also mental health, and there's social barriers and challenges. So I think it could be a component to help, but because also there are pains in so many places, I haven't seen any specific studies on it. But if they do have an underlying injury to a particular area, it can help with that. But again, it's hard to say that it's going to be the cure-all because of the immense challenges with just dealing with chronic pain like that and fibromyalgia. So I'm hesitant to say it's going to be the solution to it because there's so many um, involved issues with fibromyalgia, from, again, a physical, a mental, and social barriers for that. And I've seen that with patients I work with in the hospital as well too. Um, Next question was, where sure, I'll get these covered. Are you advocating NSAID use diclofenac past the 6 day? So it depends. So some patients who have chronic pain, they find really significant pain relief with the diclofenac patches persistently. We may see this with patients who have knee replacements or classically, we see this with patients who may not be able to go for an elective surgery. So they have bad knees, they may be on dialysis, have COPD, have heart failure, and the anesthesia says, look, we're not going to put you under with the surgeon. It is too risky. You also got pulmonary hypertension. Like we're not going to deal with it. In those cases, we see patients using diclofenac patches quite frequently for several weeks or months for pain relief. And the nice thing about it too is because it's localized delivery, it's not systemic. Patients who may be on Xarelto, Eliquis, warfarin, they're not at any increased bleeding risk because, again, it's localized delivery. It's not like taking NSAIDs with Eliquis. In addition, patients who may have chronic kidney disease or gastritis, they're able to take this without having it worsen their kidneys or their risk of bleeding in their GI tract because, again, it's localized delivery. So, again, sometimes we see patients use it a little bit longer. I typically use them for like a few days initially when I have severe pain, but afterwards I go to like the regular patches myself. Looking forward to bringing this to the Philippines. We hope so too. Is this sort of okay? Let's see here. Any contraindications with patients with new joint replacement? So you can use it after a joint replacement, but keep in mind the wound has to be healed. This is not a sterile device. The patches are not sterile. So you really got to make sure everything's cleared up. So sometimes we see some surgeons who may, after the procedure, things calm down after 48 hours, the patient's walking around. They say, hey, we'll put a SAM on you. It's going to help with your recovery, your blood flow, just make sure everything's improved. But they cut around the patch. This way, the patient's not having like the patch, touch onto the wound necessarily, but it's around the general area. But they also make sure when they check in, they're like, hey, I want to make sure this wound is closed because if I put the patch on, you don't want to introduce a surgical infection as well either. So I think that's all the questions and appreciate everyone's time and thank you for coming out.
Yeah, thank you all so much. Thank you, Dr. Mallipudi. Really informative, and we appreciate everyone's time here on a Friday. If you all have any questions beyond this, please feel free to reach out. You've got some info there. Our general email is info@samrecover. Dr. Mallipudi's email is also up there. And if anybody has questions beyond this, please pass it on.
Thank you very much, Dr.
Thank you,
Malipudi and
everyone.
the ZetrOZ team.
And thank you for organizing this, Chris, Keith, and NECOEM. We appreciate everyone's time. Wish you all a great weekend. Take care.
Thank you. Thank you so much.
Thank
Yeah.
you. Take care.
Have a great
Bye.
weekend, guys.
Thank you.